Do family members and friends sometimes have unrealistic expectations of recovering behavioral addicts?
It's very difficult to change the mindset of loved ones if they have a predetermined notion of what addiction's about. And if you want to change their mind, generally speaking, I would suggest that you educate them. And that education may come through formal mental health practitioners kind of describing things, or having them read a book, or suggesting an article, or having them talk to somebody they look up to, a physician who can explain this phenomenon in more depth than they've traditionally gotten off the street. But again, I think that the biggest danger in not being able to change a loved one's perspective lies in the notion that addiction, whatever type of addiction, is a moral or character weakness, or just as bad, even though this may seem controversial, or that addiction is simply a disease. It is a much more complex phenomenon where the individual is trying to cope with all their heart, in most cases, to cope with very uncomfortable feelings and giving them credit for it. It's not that they're weak. In fact, they may be quite strong, but they are struggling. And if there's anything the family can do, is to have empathy for the struggle, and to see that maybe you don't understand it, but if you can see the struggle within them, to accept that as part of it. It is not simple. It is not a light switch that you can turn on. It's not a book you read that you magically stop or even cut down. I even believe that accepting a harm reduction approach would help the family to roll with the relapses better, to understand it's these learning opportunities, to understand it from maybe another example would be to try, depending on who's in the family, try to find something in the history of the family or the individual within the family. Let's say mom, who's quite judgmental about the recovery of her daughter, was overweight at one time, and maybe you could show her it wasn't a single event when she decided to lose weight. She did overeat, had that brownie too much or something once in a while, and to draw some comparisons between them and some other behavior that they personally struggled with.